Hi all my wonderful TM joiners, I'm Priya Mistry, the TMJ Doc. And in this video, we're going to be talking about mouth breathing, forward head posture, and TMJ disorders. This video is part 2 of a 2-part series. So I would encourage you that if you have not seen part 1, please stop and watch that now, because the information in both of these videos is pretty complex if you haven't heard it before, and I truly believe that you'll understand part 2, this video, better if you watch part 1. In part 1, I spoke a lot about tongue posture, about mouth breathing, and about airway. So I'm going to be taking all of that and relating it to forward head posture and how all of that can kind of come together and lead to TMJ disorders. So again, the information in both of these videos is quite complex. I call both of these videos information heavy, so they really come as a pair. So again, be sure to watch part 1 before watching this one. All of these things that I'm mentioning, tongue posture, mouth breathing, airway, forward head posture, they are related, even though they might seem like they're all separate issues. Before getting into it, be sure to check out my social media and my office website for more information, or pick up the phone and give our office a call and set up your first appointment if you're looking for TMJD relief. As for this channel, be sure to hit that subscribe button and the little bell notification next to it to get notified of when each video is out. For those of you who don't know me, I'm a general dentist with a practice in Vancouver, Washington, where we are dedicated to taking care of patients with TMJ disorders. So now let's get right into it. At the end of part 1, I sort of left off with bringing together the concepts of tongue posture and nasal breathing versus mouth breathing. So I'm just going to review that really quickly. Those with correct tongue posture, with their tongue up against the roof of the mouth with a light suction, tend to breathe through their noses. Those with low or incorrect tongue posture tend to breathe through their mouths. Those who breathe through the mouth and have that low tongue posture also tend to have smaller and narrower nasopharyngeal airways, the air space behind the nose and the mouth. This CBCT, cone beam computed tomography scan, shows the airway in black, and I'm highlighting it here. The first image shows a nice wide airway and correct tongue posture. The second image shows a constricted, narrow, smaller airway and that low tongue posture that's associated with mouth breathing. The way this relates to forward head posture is that those with a narrow airway will, over time, adapt a forward head posture to ease the burden of breathing and make it less difficult. Bringing the head, and therefore the jawbone, and therefore the tongue, forward actually widens the airway and makes breathing easier. Essentially, bringing the head forward brings the tongue out of the airway. This forward head posture will make breathing less difficult for those who breathe through their mouths. So examples of famous people that are likely mouth breathers because they have this forward head posture are Napoleon Dynamite, I don't know the actor's name, sorry, Ray Romano, who I love and adore. I love Everybody Loves Raymond, but he's definitely got that forward head posture. And there's so many more, but those are just the 2 that come to mind right now. So this forward head posture over time will have negative impacts on the neck, which will then feed up and affect the jaw. Every inch that the head is forward from ideal. Ideal posture is having the ears and shoulders in line with the hips and feet. So every inch that the head is forward from that adds an additional 10 pounds of strain and pressure on the cervical spine and the muscles of the neck. The neck and the jaw are intimately related, which I talk about in depth in my video called Neck Pain and TMJD, which I've linked above and below. So be sure to check that out. Neck strain can contribute to muscle dysfunction in the head, neck, and jaw, which can then cause a lot of pain. Headaches, neck pain, and jaw pain, which are classic symptoms of TMJ disorders. In part 1, I talk about tongue posture and how it affects development of the bones in the face. Correct tongue posture supports ideal development. So what happens with correct tongue posture is that the jawbone here and the maxillary bones, these bones right here, develop forward and wide, which is ideal growth. With low tongue posture, we see that these bones tend to grow narrow, long, and sit too far back. That includes this jawbone right here. An underdeveloped jawbone, one that did not grow forward and sits too far back, will increase the chances of dysfunction inside of the jaw joints. This then leads to clicking, popping, and episodes of the jaw actually locking. This image here shows the components of the temporomandibular joint, the TMJ, the jaw joint. The condyle is the little bony knob that our jawbone ends on. On top of that condyle sits a disc of cartilaginous tissue called the articular disc. Above that disc is the temporal bone, which is a skull bone. In an ideal situation, the articular disc should sit on top of the condyle, kind of like a hoodie. And when we open and close, it should stay on top of the condyle, and there should be no clicking and popping noises. So that's ideal. When that disc starts coming in and out of alignment, it will click and pop and make noises, which is not ideal. When that disc is out of alignment, it typically comes too far forward and goes kind of in towards the centers of our heads. When the jawbone, the mandible here, does not grow down and forward, which is ideal, there's a higher chance of the disc coming out of alignment. So think about that. If the jawbone sits too far back due to lack of forward growth, which I covered in depth in part 1 of this series, then that means that the condyle, the little bony knob that the jawbone ends on, also sits too far back from ideal. This makes it easier for the disc to come out of alignment too far forward, leading to clicking and popping noises. Those with clicks and pops are actually at a higher risk for the jaw locking closed, which is a very painful condition during which you can barely open more than 1 or 2 finger widths. During this condition, the articular disc is actually dislocated. It's displaced too far forward. And so there are no clicks or pops. That's actually stopped at that point. And the disc is actually serving as a barrier to opening. It's incredibly painful and it's not fun to go through. So the point I want to really drive home here is that if the jawbone is sitting too far back due to lack of forward growth, there's a higher chance of developing dysfunction in the jaw joints with the articular disc coming out of alignment too far forward more easily. At my TMJD only practice, the majority of my patients have forward head posture, underdeveloped facial structure, low tongue posture, narrow airways, sleep disordered breathing, and breathe through their mouths. I don't think this is a coincidence. I just see it way too much. And all of that can come together and then lead to TMJ disorders. I strongly believe that all of this is related, all of this is correlated, connected, however you want to say it, because I literally see it multiple times every single day. If you're watching this video and you notice these same things, forward head posture, low tongue posture, narrow airway, sleep disordered breathing with yourself, with a friend or a family member, do not panic. Things can be done to correct all of this, but they must be done slowly in the correct order over time. Trying to fix everything quickly overnight can lead to more dysfunction. It can strain the muscles of the head, neck, and jaw, and it can cause a lot of pain. So please don't try to correct your tongue posture or force yourself to breathe through your nose if you just can't do it. You could end up kind of making things worse, especially if you're already having pain. Tongue posture, the ability to breathe through your nose, these things should be evaluated by a professional and then treated by that professional. If you're having TMJ issues, I'd first recommend getting evaluated and treated by a TMJ dentist or TMJ physical therapist. And if you're concerned about sleep disordered breathing, you can always consult with a sleep doctor to see if they recommend a sleep study. If you have difficulty breathing through your nose, I'd recommend seeing an ENT, an ears, nose, and throat doctor, also called an otolaryngologist. Quite a mouthful there. If you have low tongue posture and this is something that concerns you, I'd recommend seeing a provider who is skilled and trained in providing myofunctional therapy. Myofunctional therapy is a very specific type of physical therapy for the muscles of the head, neck, and jaw, and specifically the muscles that surround and support the tongue. These are all good first steps to take. And again, please don't try to correct any of this at home on your own because it could lead to just too much strain in the muscles of the head, neck, and jaw. Additionally, I'd highly recommend reading the book Breath by James Nestor. This book is jam-packed with information about the far-reaching negative effects of mouth breathing. And these effects can be on the entire body. So I learned a lot while reading this book. It's also, of course, jam-packed with information about the positive effects of nasal breathing, breathing through your nose. So this book even encouraged me to change the way that I breathe, and I'm primarily a nose breather. So I'd really recommend picking this book up if you have some time for reading. So I've linked this in the description box below. Please be sure to check it out. It is a wealth of information. Thank you, James Nestor. So that's really it, my friends. Again, I'm Dr. Priya Mistry, and I hope you found the information in this video helpful. If so, please feel free to like, subscribe, and share with your family and friends. For TMJD relief from the comfort of your own home, please download my free PDF guide called 3 Steps to TMJD Relief. This is available on my office website, which is linked below. As always, questions and comments are always welcome. Please feel free to let me know if you learned anything from this 2-part video series, I suppose. There's a lot of information, so you may need to watch it a couple of times, but I'd love to know if you've learned anything about yourself, a family member, a friend, etc. And remember, my friends, you can never have TMI about TMJ. Thank you.